Hello and welcome. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. In this segment, we're going to have a conversation with Dr. Tonette Krousel-Wood. She's joining us here as president of the American College of Preventive Medicine. She's going to talk about a presentation on the perceived COVID-19 impact on today's clinical preventive services. She presented this information at the PM22 conference in Denver. Welcome to Health Professional Radio, Dr. Krousel-Wood. Thank you for joining us.
Thank you so much for having me.
Well, tell us a bit about yourself briefly and talk briefly about your role as president of ACPM.
Sure. Well, thank you for the opportunity. As you alluded to already, I am a preventive medicine physician, and this is a medical specialty with licensed medical doctors that focus on preventing illness in people and in the communities in which they live. So as a board-certified preventive medicine physician, I have the distinct honor of serving as the president of the American College of Preventive Medicine. And the college, of course, is focused on the ideals that are related to the training of our specialties.
The COVID-19 pandemic has affected the entire world. What has the impact been on clinical preventive services?
Well, you're absolutely right that this has had a much far-reaching impact than we ever envisioned at the onset of this pandemic in March of 2020. What we realized with this pandemic was what happened with preventive services early on in the management of the pandemic. As you know, the things and the strategies that we put in place to prevent the spread of the disease and help us to be able to contain it and give us time to develop diagnostic tools, vaccines, and treatment measures were also the same things that probably kept us away from attending to our other medical conditions. So, stay-at-home orders had some unintended consequences of having us not going in for routine screenings, for getting routine vaccinations, for perhaps doing our routine lifestyle modifications like healthy eating and exercising on a regular basis. The good news is we have passed that COVID crisis. We now have a wonderful spectrum of activities and tools in our toolkit, if you will, through vaccines, through masking, through being able to have treatments for COVID that allow us now to get back to focusing on our general health. What we know at the time of the pandemic is that in the United States, and in particularly our communities that were marginalized and underserved, is that we had low health resilience. And that was from high chronic diseases and perhaps from other conditions that were preventable, either through lifestyle modifications or through vaccinations. So as we began to trend this information, not only in the United States, but also across the globe, what we saw was a substantial decrease in routine vaccinations. We saw a substantial decrease in screening for blood pressure and diabetes, a substantial decrease in screening for cancers like breast cancer and colon cancer. And although now that we're over the worst of the COVID-19 pandemic, some of these screenings have increased, we're still not back to where we were before the pandemic and where we should be to make sure that our communities are healthy and as best prepared for the next disaster when it comes. So this is what we detected. And what does this mean? When we don't have early detection of disease or we are prone to developing infectious diseases that are preventable by vaccines, what it means is that individuals develop more severe disease, perhaps if they're not screened early. Once their cancer or their heart condition is detected, it's at a much more severe stage, making it more difficult to treat, making it more difficult for patients to deal with the consequences of the illness. And of course, it has tremendous cost implications. Mm-hmm. And I'm not talking about just cost of treatment and cost to the healthcare system. I'm talking cost to patients. Their healthy years of life would be lost by not detecting these diseases early, by undergoing more morbidity associated and perhaps mortality associated with treatment when we're dealing with later stage diseases.
Do you feel that most of the, continue to whatever degree the continued reluctance to go in for routine or even some specialty things due to the COVID-19 pandemic is still based in just regular everyday fear? Or do you feel that people are saying, well, I think I'll just wait and see what's some more information? I'm not necessarily terrified, but I just want to wait and see.
Well, I think there are probably a lot of drivers of why people are choosing or not choosing to follow up on their own health and to attend to these routine screenings and these preventive services. So it's hard to say what the main driver is. One study that we presented at the meeting had noted that people who suffered with anxiety and depression were more likely to cancel their appointments or postpone their appointments than those who did not suffer with anxiety and depression or depressive symptoms. And so we really need to be very alert as healthcare providers, using the resources that we have in teen science to reach out to people, make sure they understand the importance of just keeping their body tuned up. Just as we want to tune up our cars and keep them running well, we want to tune up, make sure that our homes are well maintained. Well, one of the greatest gifts we have is our bodies. And so by keeping, ourselves in good shape, by engaging in these preventive services, engaging in healthy lifestyles, getting vaccinated against COVID, against the other routine vaccinations like for pneumonia or shingles or the flu vaccine. These are all very important things for us to do. So, for some, perhaps, with preventive services, you don't see immediate benefits because you're preventing something from happening. Mm-hmm. And perhaps people have gotten a little more comfortable in waiting because, it takes a while for these cumulative effects of uncontrolled disease to show themselves through illness in people. But there's a lot of concern in the healthcare system and with healthcare providers that we will have a major increase in uncontrolled conditions and later stage diseases because people are not paying as much of attention to their daily maintenance.
Is there anything that you'd like to add for our listeners?
Well, my guess take-home message to the listeners would be engage in your own health for your own wellness. Follow up with your healthcare providers and assess whether or not you need routine vaccinations, healthy lifestyle coaching, and to make sure that you're being screened for routine conditions that can be diagnosed and treated early, saving you and your families and your community from unnecessary burden and unnecessary suffering. We have a world and a life ahead of us, and hopefully by all working together, keeping ourselves in the best health possible, that we will as a community be able to withstand the next disaster or the next crisis that we will face in our lives.
Doctor, I appreciate you taking the time to join us here on Health Professional Radio. Thank you so much.
Thank you. I appreciate the opportunity, and in good health, wishing you the best always.
To you as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tonette Krousel-Wood, president of the American College of Preventive Medicine. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.